that with ECT, usually for treating psychotic depressions, you get between 9 and 12 treatments, and usually 3 a week. And people typically after a week or two are dramatically improved. And like I said, that one woman was significantly, I've seen a few people be significantly improved after even one treatment. But you have to give them at least 9, most time 12. But then if you don't continue to treat, then they will collapse back down into psychotic depression. So you've got to be co-administering antidepressants and antipsychotics. You have to do that. Now, and also let me mention something so I don't forget. Remember with depression, you keep a person on the medication for 6 months, and if there's no breakthrough symptoms, then you can discontinue, okay? The continuation phase for psychotic depressions is a year. And I mean, I've really learned this the hard way because I had 2 patients who had a very good response to antidepressants, antipsychotics, and were totally, not symptomatic. And the antipsychotics were causing side effect problems, and so I talked with the psychiatrist, and in both cases we reduced the dose of after about 4 or 5 months of the antipsychotic, and they just went back into psychosis. So it just takes longer time to stabilize. There are some people, I've only had one patient where this was the case, but they needed ongoing serial ECTs. And typically a person will go through 12 treatments and be almost always dramatically improved. But then every 2 months go in for one outpatient ECT treatment, and that's what stabilizes them. So that's fairly rare, but that can occur. I mean, that can work for some people who nothing else seems to keep the depression and the psychotic stuff away. So I'll tell you one thing that irritates me is you're hearing a lot in this class about what irritates me. I probably need to up my antidepressant dose a little bit. But a number of years ago, the city of Berkeley, you may have heard this, outlawed ECT. They wouldn't allow it to be done in Berkeley. Based on what? Because it looked bad, right? Yeah, guess what else looks bad? Suicides, and neglected children and psychotic people, So they got rid of them. They got rid of that law. Okay.
I have a question.
Yeah.
What are some of the side effects of ECT?
Okay. There are the acute side effects that last for probably a few hours or maybe a day is significant disorientation. But that clears relatively quickly. But the main side effect is that you have significant memory problems. And it's the kind of memory problems, it's a difficulty with new learning. So it's not retrieving old memories, but it's like you forget where you parked your car kind of thing. That sort of memory loss. And after the last treatment, then that continues typically for about 6 weeks and then goes away. Now, if you get on the internet, you will see, this applies to almost anything, any medical condition, you will see these horror stories about ECT causing brain damage and this kind of stuff. The clinical data strongly support that ECT is not dangerous. And some people report they have persistent memory problems, but a lot of these people have had, 6, 8, 10 depressive episodes. And we know that untreated or poorly treated recurrent episodes can cause damage to the hippocampus, which causes memory problems. So that's not to say it never causes lasting changes, but it's extraordinarily rare. Okay. And again, that typically goes away after about 6 weeks or so.
Dr. Preston, is there anything in a patient's profile that would make ECT contraindicated?
If they have really unstable cardiac condition. I had one of my patients had a cardiac arrest during ECT, but was able to be dealt with. Some people, there's one other thing. If you have a space-occupying brain lesion, this would be a brain tumor or chronic subdural hematoma, because you already have increased pressure in the brain, and when you give ECT, it increases its swelling in the brain and can be dangerous. So, if they have any suspicion that there's a space-occupying lesion, they wouldn't do it. They wouldn't do it. Somebody has real unstable cardiac condition. I had one patient. Hang on just a second, so I don't forget this. I had one patient that remember the guy said it has to last at least 25 seconds. This one guy went in And they gave him a treatment, and it lasted only 15 seconds. And so then what they did is they gave IV caffeine and waited 10 minutes, gave it again, and it lasted a minute. Because caffeine lowers the seizure threshold. So I thought it was kind of interesting. Yeah.
So what's actually happening in the brain?
Beats the heck out of me. How do you like that? That's not just a personal opinion. You ask anybody that and say it's hard to know. Now, what is clear is that it does very similar things that antidepressants do, okay? In looking at spinal fluid concentrations and neurotransmitter metabolites, when people improve with ECT, those normalize, okay? I mean, brain metabolic changes that occur with depression go away. BDNF, which is in low levels in depression, starts increasing. Okay, so you have the same kind of outcomes, although much more rapidly, but the mechanism of action is not well understood. And where ECT really was discovered was there were people that had schizophrenia, are probably more likely they had psychotic depressions, and then they also were epileptic, and they would have a seizure, and then oftentimes for a few days or a week, a lot of the psychotic stuff would go away. Their thinking was more organized, and so this led people back in the 1930s to think, what if we give them a seizure? And they tried different ways to do that. One is they injected camphor, like camphofenique, like you put on a cold. They injected camphor and then throw them into a seizure, and they did all kinds. So they found that passing electricity through was the safest way to do that. And for a long while, I would say for maybe the last 15 years, until maybe fairly recently, it was becoming more popular to do unilateral ECT, where they put one electrode here and one here on the right hemisphere. And what they found was that because there was more seizure activity in the right hemisphere, it had less effect. I mean, they have a grand mal seizure, so the whole brain is involved, but less over on the left side, and they would have fewer memory problems for verbal learning, because the left hippocampus is more associated with learning and language and that kind of stuff. But it's not as effective, not quite as effective. So I think that most people have gone back to doing bilateral ECT. And boy, if I were psychotically depressed, I'd say bring it on. Really. I mean, it's pretty amazing stuff. Okay? All right.